Hello, welcome to today's podcast on BHIS TV. Now, today we would be discussing the roles of the Nigerian Medical Association towards achieving universal healthcare coverage in Bayelsa State. And to join me in this discourse, I have here in the studio the very well distinguished chairman of the Nigerian Medical Association Bayelsa State branch, Dr. Izibeya Wilcox. Dr. Izibeya, welcome. Thank you so much for coming. It's good to have you with us on the show today. Thank you so much, sir.
Thank you.
All right, sir. You just had a training program recently. Can you just talk to the audience? Well, how was the program? What was the aim of that program?
Okay, thank you. I appreciate you for your question and the opportunity to interface with you.
Yes, sir.
Like you said, we just finished a 3-day training program for the newly elected executive members of the Nigerian Medical Association Bayelsa State branch.
Yes, sir.
And also for the heads of our affiliate bodies, because we have about 10 affiliate bodies. So the training should be for all of us because we're all occupying leadership position within the association. So we're just about a week and some days old in office. And as part of leadership, the first thing you have to do when elected is to set a goal, set an agenda for yourself. So that agenda will now be your guide and will also help you to monitor and measure the progress that you are making. So we deemed it fit to organize a program for our people. And at the end of the program, we're able to produce a policy document that contains our agenda for NMA Bayelsa State for the next 2 years with very key performance indicators that will serve as a guide for us and also help us to monitor the progress we are making and also measure the progress that we are making.
All right, thank you very much, sir. Now, sir, beyond advocating for the welfare of medical professionals, health practitioners in the states, what are those special goals and objectives of the NMA in Bayelsa State?
It's okay, thank you. Of course, the first reason why our association exists is for the welfare, the prosperity, and the happiness of its members.
That's true.
But beyond the welfare of members, there has to be the corporate social responsibility component of it.
That's true.
That has to do with what you can do to support the entire public, Bayelsa State as a whole. And I'm happy that we have a plan beyond the welfare of our members for everybody in Bayelsa State. For instance, we are not too happy with the situation of our accident and emergency and our intensive care units, so the different healthcare facilities in Bayelsa State. NMA Bayelsa State lost up to about 6 to 7 members between the last quarter of last year and the first quarter of this year.
That's great.
So we are determined to actually know what went wrong with the members we lost, and also to examine the situation of our accident and emergencies and our ICU, because in the event of any emergency, these are the places that they rush people to. That is beyond doctors, anybody at all. So we want to know what are the problems. Is it equipment? Is it manpower? We know we have equipment challenges. We have manpower challenges. Most of the equipment are bad. They are yet to replace them and all of that. So we want to identify this, and it was also one of the major areas of focus in this training.
Yes, sir.
So when we're able to identify the challenges, I know it may be beyond the scope of NMA. We may not be so financially buoyant to be able to tackle the challenges. But then NMA is a very strong advocacy group. So we are willing to reach out to NGOs. I know a lot of NGOs are willing to help out. A lot of humanitarian organizations are also willing to help out. And then also reach out to government that look, make our accident and emergency a standard one, make our ICU a standard one, because in the event of emergency, even if it is a governor that is involved, anybody at all, they will first of all rush you to the nearest hospital. That could be FMC in Nagwa, it could be Getekoki, it could be NDUTH. So we need to bring them up to standard. So we have that in mind. Then we also want to collaborate, because we can't work alone. We need to support the effort of the State Ministry of Health So we are willing to work closely with the State Ministry of Health to also improve on our state ambulance services, because sometimes now that keke don't move beyond certain hours at night, if there are emergencies at such hours, it becomes difficult for families that don't have any vehicle to convey their relatives to the nearest hospital. So we need to make our ambulance services more functional. So an ambulance should just be a call away. If there are emergencies, all you need to do is to dial a number, and the next few hours, an ambulance, or the next few minutes rather, an ambulance appears to take you to the nearest hospital to be able to help you sort out those challenges. Then also issues of quackery. A lot of people have victims of unqualified people who portray themselves as professionals and all of that. So we are willing to also engage the public concerning quackery issues so that everybody knows their limits. So we are willing to partner with the State Ministry of Health and other professional organizations, to help our people out. So beyond the welfare of our members, we have a whole lot of plans for members of the public and what will benefit Bayelsa State as a whole.
All right, excellent, sir. Amazing plans. Now, while we're talking, sir, you mentioned collaboration, that the NMA is willing to collaborate with not just the Ministry of Health, but also other NGOs, non-governmental organizations. Now, I would just like to bring to your knowledge that some months ago, the Bayelsa Health Insurance Scheme, in collaboration with UNICEF and Gavi, enrolled 10,000 vulnerable Bayelsans into the health insurance scheme. And you would agree with me that the health insurance scheme in any society is the key to achieving universal healthcare coverage. Do you agree, sir? Okay. Now, do you think that the Nigerian Medical Association Bayelsa State chapter, or branch rather, would be willing to collaborate with the BHIS towards enrolling vulnerable Bayelsans, just like the previous one that was done, vulnerable Bayelsans, into the scheme in order to complement government's efforts towards achieving this universal healthcare coverage? Do you think?
Okay, thank you so much. Yes, that is one of our primary areas of focus, how we can partner with the Ministry of Health, partner with the Bayelsa Health Insurance Scheme to increase the coverage.
Yes.
Because that is one of the concepts of universal health coverage.
Exactly.
Numbers of enrollees.
Yes.
Matters so much.
Scheme, yeah.
So I'm happy for the partnership between the Ministry of Health and the UNICEF, and also the number of persons they were able to enroll recently, especially the vulnerable groups.
Yes.
Bayelsa State, most of our people, especially within the rural areas and all of that, people are poor. So out-of-pocket payments is no longer sustainable. I work in the hospital. A lot of people are not able to foot their bills. So it's something that has taken a very threatening dimension. So we need to work very closely with the Bayelsa Health Insurance Scheme, with the Ministry of Health, to see how we can increase coverage. Then reach out to our members at the rural areas so that nobody should die out-of-pocket payment just because you are down with certain conditions and you don't have the money to pay and all of that. That is the major goals or aims and objective of the health insurance scheme. So we should be there for one another. So I can assure you that NMA is willing to collaborate with the Bayelsa Health Insurance Scheme, and we started doing something already in that regard.
Thank you. All right. Thank you so much, Dr. Izibeya Wilcox. So, ladies and gentlemen, we just heard from Dr. Izibeya, who explained to us the critical roles the NMA has to play towards achieving universal healthcare coverage. He talked about collaboration, and obviously, achieving universal healthcare coverage in Bayelsa State can only be done or achieved through robust collaboration. So not just the NMA, now this is open to other non-governmental agencies, other associations in Bayelsa. This is a collective effort, and this is a call to all associations out there to also toe this line that the NMA has taken today. Thank you so much for watching.